I'm Lindsay Farrell, and I'm the president and CEO of the Open Door Care Network. I've been here many, many, many years, starting as a volunteer in Ossining when my daughter was an infant and I needed to get out of the house. The good news is I landed at the Open Door, which was a small health center run by a group of incredibly caring, incredibly dedicated people. I think God had a hand in it because I never left, and I feel so fortunate to have been doing this work for so many years. So community health centers are truly an asset in the healthcare delivery system here in the Hudson Valley. There are 850 community health centers all across the state of New York. Open Door actually has 17 locations. We sit at the intersection of private practice and public health, and we deliver tremendous value to the people who live in the area. We do immunizations for children for communicable disease. We focus on health prevention, making sure that people can live robust, productive lives so that they can take care of their families. We really are a treasure in the healthcare delivery system here in the Hudson Valley. Open Door is open to everyone in the area. Everyone in the community is welcome to take advantage of the services that we offer. However, we have a preferential option for low-income people. Many people in the community can go elsewhere. They have alternatives, they have health coverage, but there are many people who have absolutely no health coverage and who depend on our sliding fee scale. Those are the people whom we dedicate our services to. I knew back in the day that I wanted to stay in Ossining. I wanted to raise my family in Ossining, and I recognized back then the important connection of the Open Door to the community. And so it's Open Door that has provided significant benefits to the Ossining community and to thousands and thousands of people who live in Ossining, who send their children to school in Ossining, and who make Ossining the wonderful community that it is. Open Door is a significant employer in the local economy. When I think back to the early days, we had about 30 people employed at Ossining Open Door. Today, we employ 650 people, and soon Open Door will employ more than 1,000 people. We are a big driver in the local community because our employees spend money in the local community, and that money helps local businesses and is a true resource for the local community. There are so many challenges these days. We have never experienced a time like this. Our funding is threatened, Medicaid is threatened, our very viability is a concern. In many ways, I feel like public television, who's lost its funding. However, public television has thousands and thousands and tens of thousands of viewers. We don't have tens of thousands of supporters, and so we face the future with true concerns about our ability to deliver on the mission. Medicaid is an important resource for community health centers like Open Door. Medicaid is also extremely important to the beneficiaries that it covers. Medicaid is public health insurance for low-income people. Because the federal government is making significant changes to the Medicaid program, and New York State must respond, we are particularly concerned about our ability to fund our ongoing operations. Additionally, health centers like Open Door receive federal grants, and those grants as well are threatened in the current administration. We are working to assure that we can continue to deliver the same high quality services and deliver on our mission as we have for more than 50 years. Philanthropic support is really very important, and Unique is well positioned to face the turbulence ahead because of our philanthropic support. We have a foundation that has indeed been significant in our ability to deliver on our mission over the last several decades. However, we are very, very concerned given all the forces that we are confronting at the moment. We're not like public television, who has tens of thousands or hundreds of thousands of supporters. We just don't have that broad reach. And so we're very dependent upon local people who care, local foundations that are concerned and committed to the work that we do. We're going to be increasingly dependent on local supporters as we face what's ahead in the future. We're so grateful to all of the people who have stuck with us. I remember during COVID, what a scary time that was when, again, just people from every corner of the community, from neighborhoods far and wide, were dropping off masks, were sewing masks, were giving us money, were bringing us food. We've built on that for the last several years, and so our supporters are increasingly important in making sure that the work we do is not only high quality, but meets the moment and delivers on our mission. As the Open Door Care Network, Open Door moves into the future with a much broader array of services in the community, including care coordination, case management, early childhood services. We view this name change as a way to demonstrate our commitment to the community and to extend our service delivery model much farther. It's a challenging time, but it's also an exciting time as we face many more communities with expanded reach and capacity that we've been building through the decades.